Today we're going to take a look at the role of humidity in the airborne transmission of viruses, and of course with particular reference to the current COVID-19 pandemic. If we think about today's situation with COVID, it's creating a heightened sense of awareness of the impact of airborne viruses, and in particular, as building professionals, a real need for us to consider how we address this from the point of view of the built environment. The severity and global impact of COVID-19 has seemed to catch the medical profession by surprise. However, within the field of humidification and HVAC engineering, there's been an ongoing debate as to the many benefits of healthy levels of indoor humidification, particularly with respect to reduced HAIs or hospital-acquired infections. This discussion has been increasingly supported by scientific research. Today, in light of this research, we will review the role of humidification to help reduce the transmission, infectivity, and severity of COVID-19, and briefly discuss some strategies for implementing this non-pharmaceutical intervention. Our goal will be to improve the understanding of the relationship between humidity and health and wellness, and touch on the current standards and how to have a short and mid-term response to the virus. I don't think I need to remind you that the healthcare market is a significant one. It's currently valued at about $8.4 trillion globally, and in the US, for example, the HVAC portion of the healthcare market is estimated to be close to $3 billion annually. In addition to the challenges faced by hospitals, we also see the virus impacting the long-term care and nursing home market. There are also facilities where we can expect increasing demands for building solutions to combat the virus. In the US, we have around 15,000 nursing homes, with about 70% of these in private ownership. In addition to combating the virus, the residents can benefit in other ways from healthy levels of indoor humidity. As an example, low humidity impacts the elderly with issues like dry skin and bed sores that can, in the case of diabetic patients, lead to severe infections, amputations, and even death. Why is it so critical for us to look at the role of humidification in the built environment? Healthy levels of humidification can help to reduce the spread of the virus, and in particular to protect staff, patients, and residents, many of whom are our most vulnerable population. In addition, there is a real impact in terms of cost. Although we're focusing on COVID-19 and the spread of airborne viruses, it should be mentioned that humidification has a role to play in reducing hospital-acquired infections. These infections are the cause of significant economic cost to the hospital system, where these facilities must conform to the Joint Commission's healthcare standards. Why be concerned about humidity levels in the clinical setting? There are really three key elements to consider. Firstly, the persistence and dispersion. Low ambient humidity reduces droplet size, which allows for a prolonged airborne period, which in turn allows for further travel distance. The low weight due to loss of water prevents the virus from being knocked down and then cleaned up with traditional or usual surface hygiene methods. Cleaning. Extended airborne time may be as much as 36 to 72 hours and allows for significant travel. In addition, low humidity and low droplet weight may allow viruses to become airborne after settling. We should know that this is also true for other HAIs, such as MRSA, C. diff, and so on. Secondly, infectivity. Infectivity is impacted by low ambient humidity associated with reduced droplet size, which allows for deeper penetration into the lungs where there is a less effective biological response. This is aggravated by the low humidity conditions, reducing the body's own immune system, inactivated or reduced functions of the cilia, thickened or reduced mucosa, and so on. And lastly, viral activity. Low ambient humidity levels act on the aerosol salt content, which allows for prolonged viral activity. Higher RH renders viruses inactive. In addition, higher humidity levels influence the patient's own cellular recovery. We recognize that humidity plays a role in maintaining the patient's immune response and the ability for them to fight off the disease. We've curated a number of studies that you'll be able to review at your own leisure. This presentation will be available to you, and these studies are hyperlinked here as well. They also are in the back of the presentation with individual comments. We'll take a look at a few of these studies mentioned here and touch on some details that are significant. The first study that we want to touch on is the famous Sterling and Arundel study from 1986. They concluded that the optimum range for health, wellness, and comfort was having RH between 40 and 60%. This chart is probably very familiar to most of you, as it is frequently referenced by ASHRAE. You can see the blue band. This is the optimal range for reductions in the impact in infectivity and survival of viruses. It's important to note that this is also true for certain bacteria, as well as a number of allergens. We see the positive impact of humidity in terms of human well-being, not only in terms of the impact of viral infections. 2012 study by Yang and Ma from Virginia Tech postulates the relationship between virus, solute, and water, and suggests virus viability in aerosol may be impacted by mid-range relative humidity. We have added some video and multimedia resources at the end of the presentation, and I would highly recommend viewing Lindsay Ma's YouTube hosted presentation. Also in 2012, NOTI, working with the CDC and NIOSH, researched the airborne spread of influenza. It concluded that improper mask or mask fitting, such as for the N95, provided limited protection to small particle nuclei. So as we will see later, maintaining optimal humidity levels will help to reduce small droplet nuclei formation and reduce resulting infections. In 2013, Stephen Welty presented a paper to ASHRAE based on his earlier research for the EPA and CDC in 2009 following the H1N1 flu pandemic. And yes, it was classified as a pandemic back then by the CDC. This particular paper referenced the airborne spread influenced by RH levels, and is also an excellent paper to review at your leisure. In 2018, in a real-world study, Jessica Ryman with the Mayo Clinic and DrySteam here in Minnesota conducted a side-by-side test of the impact of raised humidity levels to combat the flu in a classroom setting. Results clearly demonstrated that humidification can act effectively as a non-pharmaceutical intervention for the flu. This article by Dr. Nancy Goff from Johns Hopkins referenced the work by Dr. Iwasaki from Yale in a 2019 study, Low Ambient Humidity Impairs Barrier Function and Innate Resistance Against Influenza Infection. This is a very interesting study. In this study, the researchers used genetically engineered mice with human-like lung tissue and were able to explore the impact of low humidity on both the infectivity as well as the recovery time for lung tissue. 40 to 60% humidity was clearly demonstrated to reduce infectivity while supporting a healthy immune response and improving cellular recovery. Numerous studies have tracked the behavior of airborne viruses, and the now urgent interest is generating almost daily papers and articles. It is critical for us to understand, in light of the current research, how airborne viruses behave. Airborne viruses are expelled as aerosols through breathing, speaking, coughing, and sneezing. They're also expelled during surgical procedures such as intubation. We've seen examples recently of infections amongst socially distancing choirs on the West Coast. It is believed that COVID-19 behaves as an aerosol in similar ways to the first SARS or SARS-CoV-1, MERS or Middle Eastern Respiratory Syndrome, and H1N1 influenza, which have all been widely researched over the past 18 years. How long an aerosol remains airborne and how far it travels affects not only the spread of infection, but the severity of infection, because respiratory viruses are most harmful when inhaled deep into the lungs. Aerosols that desiccate or dry out into virus nuclei due to low ambient humidity may be traveling distances and infect patients beyond the current 6-foot or 2-meter social distancing recommendations and are demonstrated to be more effective in low humidity environments. Moving to the next slide, we can clearly see the potential for significant aerosol travel. Boralba has been able to demonstrate pathogen-bearing droplets and aerosols can travel 25 feet or further, as shown in this capture of a sneeze and the related aerosol cloud. This is significant as the aerosol cloud will be immediately acted upon by the ambient conditions, and more specifically temperature and relative humidity. A lower ambient RH will reduce aerosol particle size and weight to create virus nuclei. We've also added a link to some video from Japanese news broadcaster NHK demonstrating significant travel of both droplets and nuclei during regular speech. Droplets are by definition larger than 20 microns, while small droplets and aerosols from 10 to 20 microns. Below 10 microns, we have droplet nuclei that may be as small as 0.5 microns. In a low ambient RH environment, the small droplets and aerosols may immediately shed moisture and reduce size and weight to become a droplet nuclei. The droplet size impacts its float time, ability to travel, and its depth of penetration into the respiratory system. In this slide, we see an illustration of aerosol size versus float time and distance. As low ambient RH desiccates the aerosol, it may remain airborne for an extended period of time. Some studies have shown as much as 72 hours. From the perspective of a built environment, we have to consider the capacity of our filtration systems to capture small particle size. We should recall with SARS that it was possible for aerosol viral particles to float not only along corridors, but also out of buildings and be pulled into the ventilation system of adjacent buildings as far as 600 feet away. Very recently, researchers at the University of Helsinki in Finland have modeled the behavior of the COVID virus. In this particular example, they modeled the behavior of the virus in a supermarket setting. You can see that the simulated carrier on the bottom right-hand side has generated a particle cloud that is drifting not only through the aisle of the supermarket, but actually moving across the top of the shelving and infecting somebody in the next aisle. They found that smaller particles, so 5 micrometers or less, were able to travel significant distances. Many of you may have seen this on the news recently. When we think about particle size, we've mentioned that humidity acts on the aerosol. So as the aerosol is expelled in the space of about 1/2 to 1.5 seconds, we can see that aerosol particle desiccate and dry, and as it dries, shrinking in size. In a higher ambient relative humidity, we would be able to see heavier virus particles settle quickly. This is demonstrated by the blue particles in the bottom right hand of the screenshot. Droplet size impacts on infectivity, longevity, and depth of penetration. We've looked at how humidity impacts the viral aerosol in terms of its float time and potential travel. But another aspect which is quite critical is its impact on the infectivity of the virus. This is a respiratory virus, and the virus in the form of a droplet nuclei has the potential to penetrate deep into the respiratory tract, and in particular into the lower respiratory tract. This diagram illustrates the potential depth of penetration based on aerosol or droplet nuclei size influenced by ambient RH. This is significant as it can bypass the body's defense systems. This increases the chance of infection and the severity of the infection. In this graphic, we can see that we're able to typically capture large particles between 10 to 30 microns in our nasal mucosa. We still see a capacity to fight the virus in the 10 to 20 micron size in the upper respiratory tract. The body's mucosal layer, combined with cilia, can clear these particles. It's important to note that low RH has been demonstrated to reduce the effectiveness of both mucosal production and cilia action. Smoking and vaping tend to neutralize the body's own natural defenses, which has given rise to greater mortality. The smaller droplet nuclei can move deeper into the lung and effectively into the alveoli, where we start to see a lack of capacity or capability for our body's immune system. That's particularly important since we also know that we have no natural antibodies or immunity. This is a novel or new coronavirus. As you know, it's zoonotic. It's transferred from animals to humans. As such, we need to depend on other mechanisms within the body to allow us to address or attack that virus. Research, including Iwasaki's experiments conducted at Yale, indicate that the body's immune system is best equipped to combat respiratory infections at 40 to 60% RH. In addition to improving the body's immune response, higher humidity levels have been demonstrated to improve cell recovery and regeneration. NOTI also demonstrated that 40 to 60% RH reduces infectivity. If you look to the fourth chart D, you can see that at a 1 micron fraction, it's most infective from 10 to 30% RH and least infective at 43% RH. Again, both Iwasaki and Ma have demonstrated that an optimal humidity level inactivates the viral nuclei. Maintaining that optimal humidity level reduces the virus's viability in the environment. This can be both airborne as well as on the surface. And a number of studies have shown that 40 to 60% RH provides the greatest level of inactivation of the virus, meaning that the virus is no longer a concern to us. And of course, we've mentioned that patient cellular recovery will also be positively impacted. I mentioned that in addition to viral respiratory infections, healthy humidity levels can also play a role in other hospital and clinical care settings where we see nosocomial or hospital-acquired infections. These could be bacterial pneumonia, C. diff, MRSA, or medicine-resistant Staphylococcus aureus. In all these cases, the presence of these HAIs in the hospital and nursing home puts a tremendous burden in terms of cost of care. When we think about the cost of implementing and operating humidification equipment, we really should be cognizant that it has a tremendous ROI or payback in the sense that we're going to be able to avoid a lot of unnecessary costs associated with HAIs. We've included an excellent overview of nursing home related research on the link provided below. Within US nursing homes, it's estimated that 1.6 to 3.8 million HAIs occur annually, and that these cost between $38 to $137 million for antimicrobial therapy, between $637 and $2 billion for hospitalizations. The CDC recognizes that reducing HAIs is a priority that extends to all long-term care facilities. I hope we have sufficiently discussed the science behind airborne viral transmission and the impact of indoor air hydration, another way to look at humidity levels. Let's talk a little bit about ASHRAE and humidity level guidelines. Currently, ASHRAE's guidelines for hospitals and allied facilities vary from 20 to 60% RH, dependent on the usage of space. We should note that prior guidelines had a minimum 30% RH, but were reduced in 2008 in Addendum D of 170. From an ASHRAE perspective, some of the areas that see higher levels of RH, the intensive care or ICU, with guidelines of 30 to 60%, as well as burns units from 40 to 60%. As a volunteer firefighter, I'm quite interested in the impacts of humidity on burns. It really is very simple. If we're looking at drying out skin cells, we're looking at those cells dying. So we're looking at optimal conditions or highest humidity levels being utilized in those burns units, along with elevated temperatures to maintain patient core temperature. ASHRAE and ASHE 170, the requirements in the standard apply to related support areas within healthcare facilities, including hospitals, nursing homes, and outpatient facilities. And it's important to note that there is a new addendum to 170 that's been released looking at humidity levels in nursing home environments. Globally, it should be noted that Japan has for some time recognized the importance of higher RH levels, despite the fact that they are an energy poor country and are willing to hold patient safety and well-being ahead of energy savings. ASHRAE has recently created the Epidemic Task Force and have made resources available and the hyperlink provided. This has included a special statement that the transmission of SARS-CoV-2, which is the cause of COVID-19, the actual disease, through the air is sufficiently likely. That airborne exposure to the virus should be controlled, and that changes to building operations, including the operation of heating, ventilating, and air conditioning systems, can reduce airborne exposure. So optimizing humidification levels will be one of the means of combating the virus. We'll talk a little bit about some steps that you can take in a few minutes, but you should be aware of last week's update to the position document on infectious aerosol transmission. ASHRAE notes that the contribution of the HVAC system to help control the spread of the virus is by interrupting the transmission route. There's a recognition also of the role of relative humidity in the biological response, citing some of the studies that we've already reviewed. Maintaining temperature and humidity as applicable to the aerosol of concern, we would argue that 43% would be the optimal level. What's also significant is that ASHRAE has also indicated that it is appropriate to utilize temperature and humidity to manage the infectious aerosol of concern in non-healthcare buildings. This is a major change in ASHRAE's position on, let's say, commercial or non-healthcare facilities. I think to emphasize things, we can look to the recent statement from the White House, a clear recognition of the survival of the virus as an aerosol for more than 60 minutes at low RH of 20%. This was presented by the Department of Homeland Security's William Bryan. They have for many years focused their attention on the potential for bioterrorism, such as the post 9/11 anthrax infections, as well as pandemics such as Ebola, and they're a highly credible authority. The suggestions made after the H1N1 pandemic to the CDC and then ASHRAE and Stephen Welty's CIEQ document are likely relevant to COVID-19. Mainly a holistic approach to mitigate the virus in a phased or step manner, where increased humidity levels form the backbone of a strategy that includes increased air changes, effective UV, either in duct or in room, improved bathroom exhaust, and finally, effective filtration. Keeping indoor humidity levels at 40 to 60% RH is a safe, easy, and efficient way to reduce the spread of the virus. Not only viruses that cause COVID-19, but also, of course, other respiratory illnesses. It will not only protect the occupant's health, but as we've mentioned, may help to reduce the severity of the infection and the length of time that's therefore required for hospitalization. The addition of humidity to an indoor space can render viruses inactive and less infectious in as little as 15 minutes. Humidification systems can be quickly installed on a wall and adding moisture to rooms right away if they're using a blower or direct system. Larger humidification systems can often be incorporated into a facility's existing HVAC system, such as an in-duct air handling unit. We would recommend that any strategy starts with a site survey. Most healthcare facilities in the US were commissioned with humidification. This equipment may not be operating due to maintenance issues, may sadly have been turned off, or the humidification levels reduced. Taking RH readings using a hygrometer or checking the levels via the building management system in areas that may experience COVID cases or areas where asymptomatic cases may present will quickly determine if a facility is optimizing their defense against COVID virus. A target of 45% RH is generally recognized as providing positive benefits. If you're seeing lower RH levels, then test the equipment to see if it's operating correctly, adjust or raise set points if required, and of course work with local sales agents to explore options for additional capacity or output. If you're looking at getting there quickly, commercial grade humidification equipment provides the control you need to maintain that optimal humidity level. Simple access to power, water, and drain is all you need to get a system operational. Think of any place where there is a sink nearby, typically in hospitals or in nursing homes. It's particularly the case where you may not see centralized systems. Local reps can help determine appropriate size and type of equipment in as little as a day. With DrySteam's local US manufacturing and expedite capacity, a solution can be rapidly implemented. Equipment can be ordered and on-site in just a few weeks, sometimes faster, and installed in a day or two. And of course, you can count on a system from DrySteam to provide superior performance, protecting your staff and patients and your investment. I'd like to close with a quote from Justice Archie Campbell, who led a royal commission into Canada's SARS epidemic and is referenced in an excellent article by Harriman and Brousseau. He states, "The point is not who is right and who is wrong about airborne transmission, nor is it how far large droplets travel. The point is not science, but safety. Scientific knowledge changes constantly. Yesterday's scientific dogma is today's discarded fable. When it comes to worker safety in hospitals, we should not be driven by the scientific dogma of yesterday or even by the scientific dogma of today. We should be driven by the precautionary principle that reasonable steps to reduce risk should not await scientific certainty." I think here we can substitute engineer or building operator in place of scientist. Humidification is common sense science when it comes to protecting staff, patients, and residents. You can change or you can make this change immediately and easily. I think I need some humidification. Excuse me. So you can find more information and can follow the hyperlink to resources available on our website at www.drysteam.com, humidification for virus reduction. DrySteam sales team will be hosting additional technically focused webinars, and most importantly, you have the expert knowledge available by contacting your local DrySteam representative at find a rep link. As mentioned, you'll see at the end of the presentation, we placed a number of resources for you that are also available through our website. Please follow us through LinkedIn. I'd like to thank everybody for their time, and I believe that we're ready for any questions that you may have. Abby, could you check for any questions from the audience?
Sure, Duncan. I'm not seeing any right now. Maybe we can wait a couple seconds. All right, Duncan, I'm not seeing any comment, so you want to wrap this
Great,
up?
well, thanks. Sure thing. Thanks, Abby. Thanks, everybody, for your time. I appreciate spending the time with us this morning, and look forward to answering any further questions and helping you with implementing further humidification solutions for your facility. Have a great afternoon.